I have put on my gloves. This is important because I'm going to be touching the patient and I'm going to be touching the patient's medication. When I get to the scene, I'm going to introduce myself to Joe. I'm going to ask him what the problem is. He's chief complaint is severe chest pain. Once I get his chief complaint, I'm going to ask Joe, do you have any nitroglycerin prescribed to you? He says yes. Joe's going to hand me his nitroglycerin prescription. I'm going to take this prescription. I'm going to look at it. It's prescribed to Joe, this patient, and it's prescribed by a doctor. I'm going to put this medication aside. At this time, I'm going to check this patient's blood pressure. I'm going to get on my stethoscope and I'm going to get my blood pressure cuff. I'm going to take this patient's arm. I'm going to check this patient's blood pressure. This patient's blood pressure is extremely high. He is complaining of pain. I'm going to ask Joe, do some history taking. I'm going to ask Joe if he already had his nitroglycerin today. I'm going to ask Joe, how did you take your nitroglycerin? What route did he take? Did he take it sublingually or did he take it orally? I'm going to ask him if it helped. Did it help when you took your nitroglycerin? I'm going to note that, and I'm going to ask him if he took anything else, any Viagra. Once I gather my history, I have my blood pressure. I ask Joe what his pain is on a scale of 1 to 10. He tells me his pain is a 9 out of 10. At this point, I'm done history taking. I'm going to make sure that the patient has 6 rights of taking medication. That would be the right patient, right medication, right dose, right route, right time, right documentation. When I asked Joe for his nitroglycerin, gave it to me, I determined that it was the right documentation. He had the right documentation. I also determined it was the right medication. And I also saw in there that it was the right dose. So that's the 3 of them. I know that I'm going to be giving this patient this medication sublingually. That's the route. And the right time, which is right now, because he's having signs of cardiac issues and he has high blood pressure and complaining of a lot of pain, and it's the right patient. This medication is prescribed to him. At this time, I'm going to contact medical control. I'm going to get on the radio. I'm going to explain to medical control that this patient has severe pain. He's told me that his pain is at 9 out of 10 on the pain scale. I'm going to explain to medical control, the history that this patient gave me, whether he took his medication today, how he took it, did it help? How did it affect him? I'm going to give medical control this patient's vitals that I took upon arriving. At that point, I'm going to let medical control determine whether or not I can give this medication to the patient. If medical control determines that I can, I'm going to put the radio down and then I'm going to explain to this patient how he's going to be taking his medication. We give nitroglycerin sublingually because when you give medication sublingually, it reacts instantly, almost instantly. It dissolves into the capillaries underneath the tongue and it goes right into the bloodstream and it's quick acting. That's important for this patient right now because we want this medication to get into his system as quickly as possible. So once I explain to this patient how to take his medication, dissolving it underneath his tongue and his capillaries, wait for it to dissolve, don't swallow the medication. After I explain that to the patient, I give the nitroglycerin to the patient. He takes the medication. I'm going to wait every 5 minutes. I'm going to reassess them to see if the nitroglycerin helped. Nitroglycerin also helps with pain and it helps to lower the patient's blood pressure. Nitroglycerin is a vasodilator, which this means is it dilates the blood vessels and allows easier travel of blood to, it helps with cardiac arrest. Well, not cardiac arrest, but it helps with heart attacks. It allows blood to travel easier throughout the body because of it being a vasodilator. That pretty much covers it. After giving the medication to the patient, I want to reassess every 5 minutes, noting whether there's improvement or not, and then we would transport this patient to the hospital.